Q fever is a disease caused by the bacteria Coxiella burnetii. This bacteria naturally infects some animals, such as goats, sheep, and cattle. C. burnetii bacteria are found in the birth products, i.e. placenta, amniotic fluid, urine, feces, and milk of infected animals. People can get infected by breathing in dust that has been contaminated by infected animal feces, urine, milk, and birth products. Some people never get sick, however, those who do usually develop flu-like symptoms including fever, chills, fatigue, and muscle pain. People get infected by breathing in dust that has been contaminated by infected animal feces, urine, milk, and birth products that contain Coxiella burnetii. Direct contact, e.g. touching, being licked, with an animal is not required to become sick with Q fever. People may also get sick with Q fever by eating contaminated, unpasteurized dairy products. Rarely, Q fever has been spread through blood transfusion, from a pregnant woman to her fetus, or through sex. About 5 out of 10 people infected with Coxiella burnetii will get sick. Illness typically develops 2 to 3 weeks after being exposed to the bacteria. Signs and symptoms of Q fever may include fever, chills or sweats, fatigue, tiredness, headache, muscle aches, nausea, vomiting, or diarrhea, chest pain, stomach pain, weight loss, non-productive cough. Symptoms can be mild or severe. People who develop severe disease may experience infection of the lungs, pneumonia, or liver, hepatitis. Women who are infected during pregnancy may be at risk for miscarriage, stillbirth, preterm delivery, or low infant birth weight. Chronic Q fever, a very small percentage of people, less than 5 out of 100, who become infected with C. burnetii bacteria develop a more serious infection called chronic Q fever. Chronic Q fever develops months or years following initial Q fever infection. People with chronic Q fever often develop an infection of one or more heart valves, called endocarditis. People with endocarditis may experience night sweats, fatigue, shortness of breath, weight loss, or swelling of their limbs. A healthcare provider will need to perform a series of tests to diagnose endocarditis. Chronic Q fever is serious and can be deadly if not treated correctly. Chronic Q fever infection requires months of antibiotic treatment. Chronic Q fever is more likely to occur in people with heart valve disease, blood vessel abnormalities, or in people with weakened immune systems. Women infected during pregnancy may also be at risk for developing chronic Q fever. Prevention: Q fever vaccines are not available in the United States. Reduce your risk of getting Q fever by avoiding contact with animals, especially while animals are giving birth. Animals can be infected with Coxiella burnetii and appear healthy. Do not consume raw milk or raw milk products. If you have been diagnosed with Q fever and have a history of heart valve disease, blood vessel abnormalities, a weakened immune system, or are pregnant, talk to your healthcare provider about your risk for developing chronic Q fever.